Okay, so welcome to our second webinar on health and care focused subjects. My name is Ruth Reaney. I'm the head of health and care Travelers, and we've got our colleagues Stephanie Przybylski and Alison Manley here today, who are going to talk to us about proactive rehabilitation. For those of you who missed the first webinar that we did earlier this year, we had Daniel Freeman from Kennedy's who talked us through some of the legal challenges around dealing with difficult behaviour from service users, and was a really good talk. So if anyone did miss that and would like to see the content, it is available. So do let us know. We can send you a recording. I imagine we may well be sharing it later in the year as well. We've also got a series, some further webinars coming up later this year in June, potentially July and September. So do look out for those. I can see we've got quite a good number joined now. So over to you, Alison and Steph. Thank you.
Thanks, Ruth. Good afternoon, everybody, and welcome to this second Travellers Talks event on proactive rehabilitation support, how our customers and their employees benefit. My name is Alison Manley, and I head up the claim relationship management team here at Travelers Europe. I've been with Travelers now for just over 10 years, and I come from a claims handling and loss adjusting background, having been involved in injury-related claims since the mid-1990s. I'm joined today by our medical claim manager, Stephanie Przybylski, who leads our in-house nurse managers here at Travelers Europe and is an absolute guru on today's topic. So hi, Steph, welcome, and thank you for taking time out of your busy day to join me. Would you like to say a quick hello to everybody who's joined and tell them a bit about your background, please?
Sure. My name is Stephanie Przybylski, and I'm the medical claim manager here at Travelers Europe. I've been with Travelers just over 8 years now. I'm a nurse by background, and I have experience working both within the NHS and the private sector. I've worked in the insurance industry now for about 23 years, having gained an in-depth knowledge of rehabilitation and insurance.
Thanks, Steph. Now, before we jump into the webinar today, I need to share our legal disclaimer slide with you, which reiterates that the contents of today's presentation are an oversight of the benefit under the Travellers policy, and they don't constitute legal advice. Neither Steph or I are legally qualified. So for full terms and conditions, you would need to refer to your policy wording. I would also just like to remind everybody that today's session is being recorded for our future marketing purposes. So if any of your colleagues are interested in it and were unable to sign up to attend today, we will be able to share that with you at a later date. So now I've got that legal bit out the way, let's get on to the subject matter. Proactive rehabilitation support. It's quite a mouthful, so I wanted to start by just explaining to you that internally within Travelers, we refer to the benefit as PRS, as it slips off the tongue just a bit easier. So that's the initialism that you'll hear a lot during our session today. The purpose of our webinar today is to really give you, our customers and brokers, the opportunity to ask us questions about how the benefit works under the Employers Liability section of the Travellers policy, and to understand the steps that we take internally to support our customers and their employees who use the benefit. So whilst Steph and I will start the discussion today with a small pre-written script about PRS, we really do want this webinar to be as interactive as possible. And I'd therefore like to encourage you all to ask as many questions as you would like about anything we discuss today during this session. This really is your opportunity to ask us anything you need clarification on that relates to PRS. We don't intend on sharing too many slides, but to have more of an informed discussion. So please do put your questions into the Q&A box below, and we'll take a look at these once the first part of our presentation has been concluded. So no pressure, Steph, but it's all you and me. Now, we've worked together since 2015. I was still a claims inspector when you joined, and both of our roles have really evolved a bit since then. So I'm going back into my memory banks now to look at when we first started to introduce PRS. It was referred to as pre-claim rehab then. But if memory serves me right, it was around about 2017 that we amended it. We introduced some new wording and offered some improved covers. Is that correct?
Yeah, it was about 16, 17. The policy at that time, it was limited to the amount of rehab spend. This was reviewed and we decided this needed changing to be more attractive to our customers. We undertook a complete overhaul of the product, and in 2018, new wording, no spend limits, and the inclusion of psychological injury when it's connected to a physical injury. This was rolled out also to the Republic of Ireland as well.
Excellent, thank you. So let's take an extract at the PRS endorsement wording. Now, this is just an extract of the wording. Again, if you needed to look at the full endorsement, you'd have to refer to your policy documentation. But while our audience is looking through the words on the screen, Steph, why don't you talk through what this means in reality?
Yeah, sure. The main benefits of PRS is it provides a really comprehensive rehab assessment to support your employees back into the workplace. It gives a really good, timely access to return to work rehab program, and that's assessed at the earliest stage of medical intervention, because the earlier we get in to provide rehab, the better the outcome. There's a cost reduction, so by effectively managing and reducing the amount of time the employed person is not at work, it also is reduced in hidden costs. So there are high costs with members of staff not working, and that could include loss of production, recruitment costs, training of additional staff, and also potential overtime of existing staff to covered for that, injured employee.
So basically, what we're saying is it's an extension to the employer's liability section of the policy. It's triggered when an employee is injured at work and is signed off for more than 7 days. And then when we receive the referral within the 30 days after the incident, the nurse will review the injury, and if it's deemed appropriate, will refer it on to a suitable rehab provider.
It is, but it's important to note that 30-day time frame actually starts from the date of the doctor's note, not the date the incident occurred. And that's quite an important fact to make sure you as the customers don't think that they've missed that opportunity to make the referral. And I always say to all of our customers, it's always best if you contact us if you're just not sure whether to refer a case or not into us or not.
Okay. And actually, that is good to know. And that's something that I think refreshed my memory as we were putting the session together for today, because I'd always thought it was 30 days from the accident actually happening and not from the doctor's note. So really important, that point. Now, as you know, and I would hope that most of our customers on the call today already know, my team, the CRM team, are regularly out and about with our underwriters and brokers and you as customers to help promote the overall Travelers claim proposition. So talking about PRS is one of our main topics of conversation. And this next slide outlines how we promote PRS in 3 ways. First and foremost, the main benefit has to be to the employee. They're the person that sustained the injury. And it's really important that we showcase that actually what PRS provides is the opportunity for them to get the medical treatment they need when they need it most. And that's obviously as soon as possible after the injury was sustained. That in turn helps them to recover quicker. And this is especially important if there's a lengthy wait for local NHS treatment, because it may mean that their earnings are being affected whilst they're absent from work. And that then adds another layer of stress onto that individual employee, because it can affect their mood if they're worrying about how they're going to pay their bills. We know from experience in handling injury claims that generally the longer someone is absent from work, the more likely their mental health will suffer, with that feeling of isolation that I guess we all experienced a bit during COVID lockdowns. But they receive that frustration as well at not being able to continue their normal life because of the injuries sustained. But not only that, another benefit for the employee is that whilst they might be a bit miffed that they suffered an accident at work, they can actually see the employer is taking steps to make the referral to get them the treatment they need to help them recover sooner. And that makes them start to feel really appreciated and valued by the employer. That leads me into the segue of the benefits to the employer. So they've got an employee who is signed off sick from work, and they need to make alternative arrangements for that work to be covered by someone else, whether that's paying overtime or perhaps hiring a temporary employee. Steph, you've already alluded to this. It's a direct cost to their business. It can result in a drop of continuity of service whilst that replacement is being trained, for example. But it could also result in our policyholders struggling to meet their own commercial and contractual deadlines or obligations to their customer chain, especially if it's taken a while to retrain somebody to cover those duties of that absent employee. By using the PRS benefit, we can start the ball rolling to get the employee the treatment they need as quickly as possible. Thus, as we've already said, getting them back to work as quickly as possible. And that helps reduce that burden on the employer. And also, whilst the employee recognises that the employer took those steps to arrange the treatment, longer term, we believe it can increase employee loyalty to your business as well. But we do need to be honest. There are obvious cost reduction benefits to travellers, and those are the benefits really that we feel. You know, our customers use PRS, and it doesn't cost us as much money. Formal injury claims include much more expenses and various different elements of claim. We will likely incur investigation costs, and the claimant will have additional heads of losses, such as loss of earnings or care and assistance, or various other heads of loss, not to mention solicitors' costs as well. So formal claims, even if we're defending them, can get quite expensive quite quickly, owing to all the associated costs that go with them. But more importantly, though, the PRS benefit is being delivered because we feel it's a value-add support to you, our customers. And I know I certainly believe that that helps us to increase customer and broker engagement and ensure that our customers are more likely to remain with Travelers for a longer period of time. Of course, those are just some of the benefits from our perspective. Another important note is that as a business, we've made a decision to ensure that any PRS referral made to us is not considered a formal claim against the Travelers EL policy. This means that whilst we cover the cost of the treatment, we don't consider these cases on a customer's claims experience report. I've done quite a bit of talking there, Steph, so why don't you take over and talk everybody through the steps that a customer has to take if they want to call on the PRS benefit?
Sure. So the referral to us can be received via the Proactive Rehab inbox, or you can send it directly to reportaclaim@travelers.com. And it can be sent via your broker. It makes no difference to us as long as we get it. I will review the nature of the injury, their job role, and basically their return to work potential. Once I get the referral in from the claims handlers, I then will refer out to one of our rehabilitation providers. And I will let you know that I've got the referral, and I will also let you know who I'm going to refer it to, so that your employee is aware of who will be calling. Contact is then made to the employee by their case manager to arrange a suitable time for the assessment. It can be telephonic or it can be face-to-face. It's very much dependent on the injury. The majority of them are telephonic. Once I receive the report, I authorise the treatment, and then the rehabilitation will start. I will just let you know that we've got the report and the rehab is starting now.
Excellent. Okay. So thanks for talking through that referral process in detail. Do we always instruct the same providers for every rehab referral that we receive?
No, we don't. It's very much dependent on the actual injury, that type of injury that they have. So we have 2 rehab providers that I use for PRS, and they are a mixture of occupational therapists, physios, nurses, sports scientists. So we use quite a cross section of them. And that case manager stays with that employee until they return to work. So that's on the case management side. We also get physiotherapy assessments done and treatment done. We can provide diagnostic services from simple X-ray MRI scan, CT scan, whatever that person requires as part of their treatment. We'd also do arrange private consultations because I'm sure you all know that, you know, the NHS is very, very slow, shall we say. So we will go to private consultations. The sooner we can get somebody seen by, say, for example, an orthopaedic consultant, the quicker that we can get treatment for them and therefore get them back to work. We also have had cases where that person does need surgery, but the wait time on the NHS is lengthy. So we will also arrange and pay for any private surgery. Psychology is covered if it's as a result of the actual injury itself. And we do provide taxi accounts for attending their rehab appointments. So it is fairly strict. I'm incredibly strict with taxi accounts. So we do provide those so that, you know, people who have injured themselves, say, for example, somebody was in a plaster of Paris, couldn't drive to get to their appointment. So we arrange the taxi account so that they can get to their appointments and basically get better quicker, because if they didn't have the you know, transportation, they wouldn't be able to do it.
Okay, that's wonderful. Thanks, Steph. Now, I'm sure you also have plenty of great examples of the benefit really working its magic. So would you be happy to share a couple here? And whilst you do, I'll start checking the Q&A box to see what questions we've received so far.
So the first one is, it was a stabbing injury at work. This person worked in a shop and we had a face-to-face initial needs assessment was undertaken. She was airlifted to hospital. The injuries were horrific. So we did a face-to-face assessment on this time. So this person had case management, they had fatigue management, physiotherapy, psychology treatments. They all commenced. I received regular updates on the recovery and the progress. And I informed the insured about their recovery. The employee was really fully engaged and incredibly grateful to get the treatment that they could. She was off in total probably about 5 months, but she did return to full duties once she'd been back at work on a graded return to work for 3 weeks. So it was a really successful return to work for her.
It just sounds like such a traumatic incident for the employee that was involved in that. And I know when we were looking through the slide deck ready for today, I had a couple of questions that immediately sprang to mind from this case. The first was that you referenced the various types of treatment that were required. So were these all provided concurrently, or did one treatment start after the other had finished?
No, they tend to, be provided concurrently. The majority of the time, we don't just start physio and we'll wait for physio to finish and then say start psych. They're all part and parcel of collaborating with the case manager to get the best for them. So people do get a bit overwhelmed by rehab sometimes because there is so much going on, particularly in this case. But this person was so grateful to have it, and she did incredibly well. It's a really good case, this one.
And I guess that's also talks to sort of, if we're having to fund the travelling expenses and of knowing that, there's various appointments with various experts going on at different times that we're supporting them with. Again, if they're not earning during the time that they're off, that's really important that we're covering that cost for them and they're not having to worry about that. Okay, so my second question on this one was, who's responsible really for keeping that the employer updated and coordinating that return to work schedule?
It's generally the case manager. I can provide very bare minimum information to employers. I can basically say that, rehab is ongoing, and that's really about it. But once the case manager has got consent from the employee, they will always speak to the employer about a return to work or a graded return to work, whatever that person needs to get them back into their normal job.
Brilliant. And I believe you've got another case study to talk through.
I do. So the second case study is an injury to a non-dominant shoulder. This gentleman was given 1 session of NHS physio and he was discharged. he had a telephone rehab assessment. Case manager was involved. We arranged some private physiotherapy, and also some vocational rehab treatment was provided as well. After about 6 sessions of physio, it really wasn't assisting, so he was referred to an orthopaedic consultant who deemed he needed some surgery. So we undertook that. I think the wait on the NHS, I found out, was a year for the same operation. So the case manager liaised with the employers. Initially, it was for a graded return to work due to the nature of his job, but his full duties were achieved within 4 weeks of his return to work.
Wow. Okay. Another interesting case, and a really good example of how the benefit can extend to include surgery if required. So, out of interest there, who leads that discussion about moving from physiotherapy to a referral to a consultant and then surgery? I asked that because I know you and I have had a case in the past, and I don't think it was a PRS case. I think it might have been a formal injury claim, but we had, I know one of the reasons that you're with Travelers is because you're able to identify when treatment isn't being effective. You're able to spot when somebody's had so many sessions of a treatment, you would have expected to see progress at that point, and therefore you have recommended that they try something else. So in the PRS space, who leads that discussion about saying, well, that's clearly not working, we need to try something different?
I think it's all of us working together. So myself and the case manager has a clinical background, and we all know roughly 6 sessions of physio, you should be able to start to see some benefits. But in this particular case, there wasn't any at all. So the case manager had said to me, could we arrange an orthopaedic consultation, which we did. And as I've alluded to before, it was successful, and he did have his surgery. And that tends to happen all the time. I collaborate with case managers constantly about what we can do to get the best outcome for that person.
Okay, brilliant. So we've got a couple of final points before we go to your questions. So please use this time again to get any questions that you have into the chat. This slide, however, that we're talking about really looks at the differences between when we receive a formal employer's liability claim versus a PRS referral. We spoke earlier about cost savings, and it's clearly evident on this slide here. And of course, you can see that, we've highlighted it in red. The average claim spend for an employer's liability claim, or even if it's a sort of quite attritional injury, is around £16,500. Yet for the same treatment that we deliver before a formal claim has come in, actually that's reduced to less than £1,150, which is great. Obviously, that helps keep the net loss ratio performance of an account lower. So I'm sure that's really welcomed by all of the brokers that we've got on the call today. In summary, we really believe that there's some real pros for our customer to utilise the benefit rather than wait for an employee to potentially make a formal claim for compensation against them for an accident at work. But I think we do have to recognise that using PRS never prevents the employee from making a formal claim for compensation. They always are entitled to have that opportunity to make a claim should they wish to. So if a claim is made, Steph, whilst PRS is being utilised, am I right in saying that the rehabilitation will stop unless we believe that legal liability will apply and we just continue it once we've got consent from the solicitors representing the claimant? Is that right, or have I got that wrong?
Yes and no. We put rehab on hold is what we do. And the claims handler will then investigate the liability, whether we deny it or we accept it. If I have already authorised, say, 6 sessions of physio and 6 of psych, I don't stop those. They've already been authorised prior to any formal claim coming in. So we continue with that treatment, and then it's just put on hold. The claims handler do their bit, and then they will let me know if we've accepted the claim. If we accept the claim, then I would then contact the claimant solicitors and basically ask to work collaboratively with them so that we can get the best for their for their client. 99% of them, I would say yes. And we just carry on with the rehab in a different format because we've got a solicitor on board.
I guess where there's somebody else that can take that organisation of rehab off their shoulders, that's one less thing for them to do, really, isn't it? So
it is.
Yeah. Okay. So I know you're really passionate about this benefit, Steph, and you're really proud, rightly so, on how we are able to help people recover from what can sometimes be quite debilitating injuries. Before I dive into the questions that the audience have asked of us today, is there anything that we've missed that you think we need to share?
It's a great product, but I am a little bit biased. So obviously, it resonates with my background as a nurse, wanting to help people when they're sick and unable to go about their normal daily routine. One of them is being work. That's the biggest one, I think, for a lot of people. We are all the same. We're creatures of habit and want things to return to normal. Some of our customers that are on the call today have utilised PRS, and the feedback we have had is that they see the benefits and how effective it can be. And also some of our customers that are in the health and care sector, it's important to note that their clients are used to the same person working with them, and the return to work of that employee helps reduce any care disruption so that they have the continuity of the care. So, it works really well.
You've made some really great points there, Steph. I mean, I know that for our customers in the health and care sector, that continuity of care for their clients or service users is key to ensuring that they don't suffer from any increased or challenging behavioural changes as a result of their normal care provider not being available to work with them. And on that very note, before we conclude, I am going to read a quick testimonial that we've recently received in relation to our PRS benefit. We regularly ask for feedback, as Steph's already mentioned, and I'm really pleased that I've chosen this one today. It came in last week from Sarah Cole, Health and Safety Manager at Creative Support, who I hope has been able to join us today. I don't normally read slides verbatim, but this is such a phenomenal piece of feedback that I am going to do that. So Sarah wrote, Creative Support was looking for an insurance company that understood our ethos and values, and Travelers Insurance has more than delivered this. Travelers took time to build a relationship with Creative Support and provided a range of options to support us. One of those options was the Proactive Rehabilitation Service. Staff who are injured in incidents at work are offered nurse-led rehabilitation support, which includes physiotherapy and counselling. One staff member who was grabbed by the hair was even referred to a trichologist. PRS is a visible way of demonstrating to staff that as an employer, we look after their mental and physical well-being and each staff member's contribution. With PRS, injured staff are well supported and many return to work after a short period of time. Corporately, we have seen a large reduction in employer liability claims by staff. PRS has helped to enhance our safety culture and demonstrate Creative Support values to all. Thank you, Sarah. It is amazing feedback, and Steph, kudos to you for everything that you do in doing that. I know there's a wider team within Travelers that support our customers, but it's clearly evident from that piece of feedback from Sarah that PRS is going a long way to helping them make sure that they feel like we're providing something that's of real benefit to them and their employees. Okay, so let's get rid of the slides for a bit and let's just talk, you and me and Ruth, if we get stuck. We have a couple of questions that we received prior to today that people wanted to ask. So I'm going to start with those. The first one is, my organisation already has an occupational health provider. How does the Travelers PRS benefit work alongside that?
I don't think it really... Kudos to the employer that has occupational health, because it is a rarity these days. But it doesn't really work alongside it. It works, I suppose it does work separately, because we are doing the case managers are doing the hands-on stuff, the physio, the psych, etc. Whereas an occupational health provider, I presume that comes from their health and safety people. So if that person is returning to work, are they fit enough to return to work? Or if they've been off for a long time with their injury, and they do that assessment, and they may do the graded return to work, which means our case manager doesn't have to do it. So we do the hands-on, that's the only way I can describe it, and they are just looking at, can they return to work after having this injury? Are they safe to return to work? So it works very differently from one another. I don't really get involved at all with any occupational health reports. I never get them sent because I don't need to see them really.
Okay, brilliant. I always say that your job is to give the injured employees the cuddles.
Indeed.
That's what you're there to do. You're there to give them the cuddles. Okay. I think we've already alluded to this today, but there was a question about how will my employer be kept informed of the progress of treatment that my staff member is receiving. So you mentioned that's about the case managers in communication and things like that. So there was another question that we received prior to the webinar today, which was, if an employee is absent for something such as work-related stress, would that be covered under the PRS benefit?
No, it's not covered. It's only as a result of the injury. So if somebody has fractured their tib and fib, and they can't get around, they can't get out, their mood reduces, then we need to provide some psychological support, because if somebody's mood is low, they don't engage in rehabilitation. So we need to keep them engaged so they can get better.
And that's key as well, I guess, in that whole doing the referral early before that mood reduces, isn't it? Okay, so there are 5 questions currently in the chat at the moment. So the first one is from Naomi. And she has asked, you mentioned that there is a motor RTA exclusion. Is there an intention to extend the offering to employees injured while driving for work or injured third parties? Now, my immediate response would be no, because that would be covered by the motor insurer as part of the RTA responsibilities. Ruth, this is probably more a question for you to answer, putting you on the spot there.
No, there's, as you say, Alison, there's no specific intention to change that at this time. So it would be to go to their motor insurer really at the moment.
Okay, excellent. Question in from Simon, which is there any evidence or research that estimates how many liability claims PRS prevents? And I guess we probably do have some data somewhere behind the scenes. It's difficult, isn't it? Because by utilising PRS, a formal claim hasn't been made. We would be able to go back and look at data to see, how many claims we've had historically in previous years compared to the number of claims that we receive now, I guess.
I think we've got some data, haven't we, obviously on people using PRS and how many of those then go on to claims. I suppose if you counted the ones that didn't claim and worked out a percentage of those as ones
that would be a good guide. So I think the answer at the moment, Simon, is that it's not something we've probably looked at, but maybe a good shout of something that we should look at, I guess. So we'll put that on the to-do list for you and I, maybe, Ruth, to dig into. Okay. Right. So the next question that we have is from Mike. It's quite a long one. Okay. It was seemingly mentioned that the costs incurred for this wouldn't go on our client's EL policy. Is this because the costs would fall on a separate part of the policy? If not, how do the costs affect our client's claims experience? Shall we answer that bit first before I go on to the next bit?
So no, they don't go on the client's claims experience. We don't attach them to any other part of the policy at all. We just pay for it, and that's at our cost. What we can do, though, is usually at renewal or whenever else, we can give the broker and the client an idea of what we've spent, so you can put some value towards it in terms of the proposition, but it will never form part of the claims experience, and we'll stand by that. So yeah, that's a really clear part of the offering.
So the second part of the question, Steph, and I'm not sure again if we've already alluded to this a bit, but was, in addition, if yourselves intervene and assist with the employee, then after investigation, it transpires that the employer policyholder was not negligent in any way, how would you proceed? Would the employee in question have to pay the costs? Would Travelers absorb them? Or would the costs incurred up to that point go on the policyholder's claims experience?
Yes, it's not going to go anywhere. I think, Steph, you said that obviously once the claim has come in, you will pause agreeing any further treatment, but anything we've already agreed to pay for, we will continue to pay for. And again, that's not a cost we're passing on, whether or not the employer is deemed to be at fault in any way. It's just that obviously then we may not agree any further treatments if it's found that there's no real merit to the claim. Is that fair to say?
Yeah,
Steph?
that's right. Yeah.
But there's no risk to either the employee or the policyholder that any costs will then be passed back to them. It's always going to sit with Travelers.
And it's important to note that as a business, we've made that decision, haven't we? Because we can see the cost savings that are available. Even if we're taking a hit of £1,150 a referral, it's still so much cheaper than we would be paying for an average defence claim on non fault EL matters that were referred to as formally, where we've had adjusters involved and potentially had to do lots of other bits and pieces and incurred costs along the way. So it's our decision to take that hit, isn't it, really? And that's why we sell it as a value add benefit under the policy, rather than anything that's going to affect the customer's claims experience. Okay. Next question from somebody who wishes to remain anonymous is that I see there was a psychological element. Does it work for psychological injuries alone?
I would say no, because it's not that type of policy. It's an injury at work. So if it was stress at work or bullying at work, it wouldn't be covered under the PRS.
Yes, only if there's been a physical injury, which has resulted in some psychological damage.
Oh, okay, here's the next great question. What do we do if our attendance policy requires an employee to be terminated and PRS is ongoing?
Have you ever had this situation, Stephanie?
No, I haven't actually. No.
I imagine that perhaps, obviously, anything that we've already agreed to, we will continue to, because we could still have a claim from that person, whether or not they're possibly more likely to have, perhaps, if they're being terminated. Would we even be made aware at what point they were terminated?
I think we would, because I think it would be the case manager would know that, because the employee would say, I've finished work, because, return to work is a big part of PRS. So I think it would be the case manager. Case managers tell me a lot of things, like John Smith said he's going to go and get a solicitor kind of thing. So we're always on, we always know, but sometimes they just don't appear. But in terms of this, I would imagine it would be the case manager telling us in a progress report, oh, by the way, he has been made redundant or let go, whichever it is. So as far as I know, the rehab continues. I update the claims handler and they, will let me know what to do.
It would be at our discretion, wouldn't it? Because it's a policyholder benefit, but it doesn't, if the policyholder, they are effectively no longer an employee of our policyholder, then it would be at our discretion really to continue with that or otherwise, I suppose, wouldn't it? But it's not.
It might be also something to do with the injury. If the injury was quite a big injury, we'd be foolhardy to stop it, I think, because then, we're continuing to look after them, and hopefully it would then stop a formal claim coming in. I mean, I have had claims come in where we've done all the rehab and they've gone back to work, and then you get a claim. sometimes, and I sit there and go, but we've given you everything. So some people do it. It's just one of those things.
I guess when that happens, though, we are on the front foot from a defendant insurer, in that we know what the injuries were, we know what treatment they've received, we know what the recovery prognosis was. So when we start receiving those, let's say, I don't know, very, very descriptive letters from claimant solicitors describing how severe the injuries are, actually we have a little bit of knowledge already about how much of that is accurate or not. And it can help us assess the claim much quicker. I know just on this point, in the past, we've had conversations with policyholders where they've tried to get the employee to engage in using PRS, but they haven't wanted to because they quite like the idea of being off work for a long time, particularly if they're on an employment contract that sort of gives them 6 months full pay or something whilst they're absent. So they don't necessarily have as much of an incentive, and they've actually used their lack of engagement in PRS as part of a disciplinary process longer down the line. But I've never seen it this way round, where PRS has been ongoing, where there's been a termination. So,
and also, if it does go to a claim, the other thing, if it does go to a formal claim and we accept it, and you get a solicitor's letter in that gives us a whole list of injuries, we know everything beforehand because we've got the reports, they've discharged from physio, etc., etc. So they might not even have met their client, which is highly likely, but we do have all that information. So that's great for us if we're defending it, when we're defending it.
One final question that we've received in was from Michelle, who has said, will there be a recording available to view? She overran at a prior meeting, so could only join. And the answer to that is yes, Michelle. The session is being recorded today and it will be available. I'm not sure how long it's going to take us to get it pulled together, but we will make it available for future reference. So if you just want to reach out to one of your main Travellers contacts, and we will get a copy to you as soon as we can.
Alison, there's a couple more questions actually come in.
Oh, has that? Wow. Oh, my word. Yes, there has. Oh, brilliant. Okay. So next question. You said that this sits on the EL policy only and motor is excluded. Can this ever stretch to contractors or members of the public if they are on our site?
It is an employer's liability benefit, so it would just be for people who were deemed to be picked up by the employer's liability policy. So it could potentially be volunteers or people that would fall within the definitions of employee, but not really to contractors or third parties. It's not what this policy benefit is for, unfortunately.
And Simon's asked another question. Simon, please don't apologise for more questions. That's exactly why we wanted the session today. So Simon's second question is, must an employee use the PRS rehab providers, or do they potentially get a choice if they have a preferred physiotherapist, for example?
Well, probably no, they don't have a choice. However, if they've got their own physio and that physio perhaps is on the network of our physio providers, then for me, there is no reason. However, if it's an independent physiotherapist, the case manager has to then do due diligence on that provider to make sure they are the correct provider. I've actually probably never had that before, but that's what we would have to do. So no, they don't get any choice. But we would always look at it. Of course we would, because a lot of people have had physio before and they get on very well with their physiotherapist. But that's the process we would have to go to, and that can delay treatment because not everybody wants to give you all their insurance information, etc., and their costs. The costs for me, all of the costs for PRS, I don't take that into account personally. Probably shouldn't have said that, but I don't. It's the outcomes that we're getting for that person. So if I've got a provider that charges a bit more than another physio, it's whether we're getting number one, good value for our money, but also the main person is that employee. It's getting them the right treatment.
Which is exactly why I say you're the person that gives everybody the cuddles. You're not, and you don't come at it with an
Sometimes.
insurance head on like the rest of us. You're not a cynical insurance person.
Don't know.
You're a nurse. Okay.
One
One
more.
more just stuck in there. Okay. So Neil has asked, could your publicity fact sheet for PRS be made to highlight the 30-day reporting deadline from the date of the first certificate if it doesn't already? It's information that policyholders need to have, and not a lot of them read their policy wordings top to bottom. I'm sure that's something that we can speak to our marketing team about. And if it's not already on there, the literature is there, but I don't know if it says 30 days from date of doctor's certificate.
I don't think it does, but it is in progress. We are changing it. So I kind of watch this space, but yes, I agree with you.
Space. Perfect. Okay. Are there any more questions? Last chance saloon.
If anyone does have any questions afterwards, please feel free to get in touch, or either with your normal Travelers contact, any of us. And I think we do have one final slide with the contact details.
We do. Yes, absolutely. So one final point of note for everyone is that that I just wanted to get out is that all of our liability claim professionals are trained to triage every new EL notification that's submitted to us via our normal reportaclaim@travelers.com email address. So even if it's a notification only submission that's been sent in to us, we will take the opportunity to review that and have a look at it. And if we think that it's something that is suitable for PRS, we will contact you, or the claim professionals will contact you to recommend engaging the benefit where they feel it will assist. So I just want to thank Steph and Ruth for their contributions today. The slide attached, obviously, that's showing at the moment does show you how to get in touch with us and contact us. I really want to thank you all for joining us on the session today and for asking some really good questions there. From us, we will be following up after today's session with a feedback survey, and we really would appreciate it if you would take the time to give us your feedback, good, bad, or indifferent, but hopefully good, so that we can continue to work on our future webinars to bring the most value to you. In addition, we'll also arrange for an email to be sent out to include a copy of the fact sheet and the PRS referral form so that you can retain that and you can use it as and when you need to. One final point of note before I hand back to Ruth is that I believe our next webinar is on the 26th of June from Colin Todd of CS Todd and Associates on the topic of fire safety in specialist housing. And it is, yeah. And obviously, if that's of interest to anybody, please feel free to join it.
Specialists in that area, and I know it will be a really good one. So hope many of you can join us for that, and look out for other ones coming later in the year. We've got more to come as well. So thanks very much, everyone, and see you soon.